Okay, if you're watching this is part 2 of my Inspire sleep apnea post-surgery. There is a first video. If you haven't seen that, you might want to check that one out first. It's 10 minutes. It was the day after surgery and where I was at. So you can see here, we are at day 9 now. Feeling much better than I was day 2, day 3. After those couple days, my throat was very sore. It was soup, jello, pudding pretty much for 3 days. And by the 5th day, I was able to choke down a steak, so I was happy about that. As far as soreness, you can see here where the incision was. It's very hard around it. It's weird, but yeah, it's very hard. Looks like it's doing all right. You can still see where it's all swollen here. I'm getting some of my shape back, but over here it's still swollen. When I open my mouth, it's still real sore. It feels like somebody has their thumb shoved up in there. But I am able to eat anything I want. It's not like swollen razor blades like it was 6 days ago. So that is feeling a lot better. My incision, you can see that it's right here. It still has that, feels like glue, super glue on it. That's supposed to fall off. It hasn't yet. I feel like up here on my throat, it has pretty much come off. Obviously no shaving around it, but it is feeling better. I had my 1 week post-op surgery meeting with the doctor yesterday. It's 5 minutes. Said everything was looking great. I come back in 3 weeks and they'll turn it on. He said I was the 15-pound weight restriction, whatever, is off. I could do whatever I wanted at my discretion. I asked him about golfing. He said give that 1 more week. You definitely can feel, it feels like there's a piece of duct tape stuck to you and you just feel it as you pull away. You can feel the Inspire behind here. I mean, it's probably some swelling, but you can feel it back there. It's kind of weird to get used to. It doesn't look like it's going to stick out like maybe a pacemaker or something would, but you definitely can feel it. So I took my 5 days of the antibiotic. That was 3 times a day. The pain pills that I took those pretty much just before bed to try to get sleep without waking up. Other than that, it's just been ibuprofen. I didn't take all the pain pills. I didn't need them. So I'm able to do whatever I can do. Like the doctor said, I mowed on my riding mower, a little bit of bouncing around, but it just feels a little weird, but everything's going in the right direction. So have 3 more weeks, go back and they will turn it on. And from what the doctor said, they'll set it at a level that it won't even wake me up, but they'll see, he'll turn it up, and as he turns it up, as soon as he sees my tongue stimulate, then that's where they're gonna leave it at. And then I'll leave. I'll use the device to turn it on, turn it off for a month, and then we will, I go back in to see a different doctor with Inspire, and I think they check out the data and see where I'm at and see what they need to do. But in the meantime, I have this Inspire, like I showed before. It looks like a mouse. It's the first time I've taken it out, but looks like a mouse, and we'll get that going. There's some instructions in here. The only thing I'm supposed to do is download the app and get all that stuff taken care of so that when I go in 3 weeks from now, I just speed up time and get things going. But as of right now, it's doing a lot better than the first few days. I did ask him about why my tongue was all bruised, and like I said, my uvula was even bruised. And he said that the anesthesiologist, they had like it was like a metal shoehorn, but they had that in there shoving your tongue out of the way and the hose down. So yeah, that was that was the pain from that and the bruising, I guess. So I don't see another video coming until after they turn this thing on in 3 weeks, and we'll see how it's going from there. But any questions, leave comments below. First video I did have a question, and somebody's having the surgery on Wednesday. Hopefully that was yesterday actually. So hopefully they're starting to heal up. It'll be a little while, but got any questions, leave some comments. If not, I'll be back for part 3 in 3 weeks. Have a good day.